Welcome back to PhysioFeed, your go-to channel for physiotherapy. Today we are diving into forefoot pain, what it is, how to assess it, and what you can do about it. The forefoot is a complex area that supports a lot of weight during walking, running, and even standing. If you're experiencing pain here, it could be due to several reasons. To make the assessment of forefoot easy, let's review the conditions which a patient most likely presents with. Stress fracture of metatarsals, fracture of the fifth metatarsal, metatarsophalangeal joint synovitis, first metatarsal joint sprain or turf toe, Hallux limitus, stress fracture of the base of the second metatarsal, Hallux valgus or bunion, Sesamoid injuries, Freiberg osteochondritis, Morton's neuroma, Joplin's neuritis, toe clawing, cons and calluses, and plantar warts. First, let's talk about the subjective assessment. This is where we get the information about patient's pain. Questions regarding location, onset, duration, and aggravating and alleviating factors are asked. This table summarizes the pain location and onset. Questions like how long have you been experiencing this pain, does it come and go, or is it constant are asked. Questions like what makes the pain worse, is it worse with certain shoes, after prolonged standing or when walking barefoot. Pain during running or dancing is often due to metatarsal stress fracture. Ballet dancers are prone to stress fracture of the base of the second metatarsal. Deep aching sensation that is aggravated by walking, especially in high heels, confirms Hallux limitus. Now let's move on to the physical examination. The first step is observation. Check for abnormalities like Hallux valgus, toe clawing, Morton's foot, plantar warts, cons, and callus. V sign is seen in early stage of metatarsal joint synovitis. Palpation can help identify specific pain points. Following areas of forefoot is palpated: metatarsals, first metatarsophalangeal joint, sesamoid bone of the foot, space between third and fourth metatarsal, distal third of the fifth metatarsal. Focal tenderness reveals stress fracture of the metatarsals. Localized swelling and tenderness occur in first metatarsophalangeal joint sprain. Tenderness and swelling overlying the medial or lateral sesamoid indicates injury. Local tenderness if acute spiral fracture is present. Localized tenderness and palpable click on compression of the metatarsal heads indicate Morton's foot. Here's a list of movements physiotherapists can check. Pain aggravated by passive forced flexion of the toe indicates spiral fracture of the distal third of the metatarsal. Passive plantar flexion and dorsiflexion of the first metatarsophalangeal joint indicates turf toe. Passive gliding of the joint in a dorsal to plantar direction can be used to evaluate the plantar plate injury. Resisted plantar flexion of the great toe elicits both pain and weakness. It is a sesamoid injury. We may perform specific tests like Mulder's click test for Morton's neuroma, squeeze test for metatarsal stress fracture, or modified Lachman's AP draw test for plantar plate laxity. 2 mm or 50% joint displacement is a positive sign. Based on the assessment, we will consider different diagnoses. For example, if the pain is localized to the second or third metatarsal's head, we might suspect metatarsalgia. If there is tingling or numbness between the toes, Morton's neuroma could be the culprit. X-ray assesses the degree of degeneration of the joint if spiral fracture of the fifth metatarsal is present. Small periarticular flecks of bone are noted in turf toe. Classic characteristics of degenerative osteoarthritis is seen during Hallux limitus injury. Axial sesamoid view is recommended for sesamoid fracture. MRI is conducted for turf toe if grade 2 and grade 3 injury occurs. MRI differentiates between a bipartite sesamoid inflammation and a fracture.